All right. All right, I hope everybody's ready for Christmas. I am not, so if you guys are, kudos to you. I have very little shopping done so far. Unfortunately, we were under house arrest for our quarantine for a couple of weeks, but everybody's good and I'm still negative, so that's wonderful. Um, we'll go ahead and get started here. There has been a new development with the COVID testing. We are still testing with our lab right now. Today's positivity rate from as of yesterday is 70.8% in Madison County, so we are still in the red. Due to the CARES Act funding suspension, we'll be moving into an every other week testing for all staff and residents starting at the beginning of the year, 2021, until we have depleted our in-house inventory of the antigen testing kits. We will be able to use those for probable cause and or to supplement the lab testing when necessary. So beginning in January, we will be moving away from being tested 2 times a week, and we will start testing every other week, all staff and residents. Not sure yet if that's going to be on a Tuesday or a Friday. We are kind of at the mercy of the lab on that as far as their scheduling goes. We were lucky enough to be able to get our Tuesday and Friday schedule in place, locked in place with them recently. But since the changes are coming down from the state due to the funding suspension, we will kind of play that by ear, and we'll let you guys know when we know what days those are going to be on. I am very happy to say that as of yesterday, which would have been Tuesday the 15th, all of our residents and staff tested negative again. So porch visits are back on. We're firing that patio heater up. So if you guys want to visit with your loved ones, please call ahead and schedule so that we can have the heater ready and the little location outside on the front porch warm. And we are still asking that you schedule any deliveries to make sure that we have time to properly sanitize those items before we take them back to your loved ones. I know a lot of you guys are going to be delivering goodies for them for Christmas. If you're not going to be taking them home with you for the holidays, we are still suggesting that you deliver anything in either plastic containers like Rubbermaid containers or Gladware, or that you tie them up in a plastic bag so that we can spray those items down before they come into the community. This has been proven to help us quite a bit during this lovely time since March. So we're going to continue to sanitize everything that comes in our door, and just ask that you be cognizant of what you put your items in for your loved ones so that we can spray those things down. And we got some really exciting news. We are moving forward with the vaccine. As you guys know, it landed in Louisville a couple of days ago, and the University of Louisville hospital staff got the first rounds in Kentucky. There is a little bit of trickle down information, but not a lot. I will share with you what we've learned so far. But to prepare for the clinic, we want to say thanks for all of those of you that have dropped off or emailed in your information to Ms. Tasha for your loved ones. And if you haven't had a chance, time is of the essence. So please remember to send those to Tasha as soon as you can. And I deleted out one of the .coms from last time. So her email address is accurate on this slide. You can send those to hcc@arcadiancoveliving.com, which is one less .com that I had on there last week. Just another quick reminder, be sure to sign the VAR or the Walgreens vaccine consent form that came to your email for your loved ones if you would like for them to receive the vaccine. We got a call just about, actually less than an hour ago. Ms. Tasha spoke to one of our representatives from Walgreens. They will be calling us on Monday, the 21st, to let us know what dates and times we can expect the clinics to be set up here at Arcadian. So like I mentioned, time is of the essence. If you would like for your loved ones to have that vaccine, go ahead and get that information into us. If you have any questions or if you run into any roadblocks, please feel free to email us or call us at your convenience. We are here to help, and we definitely want to make sure that everybody that wants the vaccination can get it. I would like to let you guys know that it does look like that we are going to vaccinate our staff and our residents during the same clinics. So it looks like the residents will be vaccinated at the same time as the staff members. here at Arcadian. And we will have 3 clinics set up, so we will be doing our staff in waves because they are reporting that there are some side effects that are present anywhere from the first hour to around 12 hours in. We do have a lot of questions about side effects. What we know is basically what's coming down from Pfizer, which is the vaccination that I understand that we will be receiving at Arcadian. And many of you may have seen this information already. It was in some of that documentation that I sent out last week, but it's the usual side effects that we know so far, kind of the same, along the same lines of the flu shot. And that's injection site pain, tiredness, headache, muscle pain, chills, joint pain, fever, injection site swelling, injection site redness, nausea, a general feeling of unwell, and some swollen lymph nodes. They are suggesting that anybody that has immunosuppressant therapy currently, or are considering becoming pregnant, or are pregnant and breastfeeding, or if you have a history of anaphylaxis or anaphylactic shock due to severe allergies, that you speak to your primary care physician before signing up for the vaccination. I'm not sure that we have a lot of folks here at Arcadian that have those types of scenarios, but they are saying there is a remote chance that the vaccine could cause a severe allergic reaction. I think pretty much every vaccine across the board does as well. So within a few minutes to 1 hour after getting the dose, signs of a severe allergic reaction can include difficulty breathing, swelling of your face and throat, a fast heartbeat, rash all over your body, dizziness, and weakness. And these are the severe allergic reactions that have been reported so far in the clinical trials that they have had with the Pfizer vaccination. So those have been reported. Obviously, they're going to say that there could be others. So we'll just keep an eye out for those. As we learn more about the side effects and the potential for severe allergic reactions, we will educate our staff members on what to look for with the residents who receive the vaccine. We will have a list posted in the staff station, and of course we will communicate fully transparently with our staff members who receives the vaccine, so that we can keep our eyes on those residents, your loved ones, to make sure that that they are progressing in a positive manner, and that they don't need additional medical attention. If they do, obviously we'll call you right away, and we will consult 911. And that's all that I have so far for today. Want to just discuss really quickly that if you are interested in taking your loved ones home for the holiday, obviously we want you to be able to do that. When they return, they will be imposed with a minimum 10-day quarantine. What the suggestions are right now for holidays when residents return to communal living is that we test them 3 days after they return, and again 7 days after they return. And if on the 7th day they test negative, they can come out on day 10. I think I got that correct. But there is a minimum 10-day quarantine for anyone that does go out with their loved ones for Christmas. And I think during this year, as crazy as this year has been, I think 10 days is probably pretty doable for us to be able to spend Christmas with our loved ones. So we are just asking that if you are interested in taking your loved ones home, you just, as usual, communicate the dates with us and let us know. I did want to provide a brief update, a quick update on our one resident that did test positive. Of course, I can't share that person's name with you, but wanted to let everybody know that that person is progressing positively and doing well. And we would like for you all to continue to pray for that resident if you are praying folks, which most of us are, I think. And if you're not, just to think positively for that person's recovery. We would like to get that person home as quickly as we could. And at this time, I'll open the floor up for questions. Does anybody have any questions at all? Feel free to unmute yourself and go ahead and ask.
Can you bring a package or decorations for their room if you don't do the door?
Absolutely. Yes, ma'am, Miss Karen. You can surely bring anything that you would like to make their apartments festive and to feel more like Christmas.
Okay, good.
Anybody else have any questions?
What about Christmas gifts?
Christmas gifts, yes. We're just asking that if you bring any gifts, that it be in a package that we can spray down with Lysol. If your loved ones happen to be allergic to a Lysol or disinfectant, what we normally do is we'll wipe it down with a dry cloth and leave it sitting in the vestibule for at least, I think it's 2 hours to leave it sitting in the vestibule. But yes, if you want to bring gifts, we definitely encourage that as well.
Good.
Anybody else have any questions? Well, if there's no other questions, I want to wish everybody a very Merry Christmas. We will reconvene next week on Wednesday because Thursday is New Year's Eve. I'm sorry, the following week, next week is Christmas. So on December the 30th, we will have our call at noon, and I will definitely get out some information to you guys. In between today's call and next Wednesday, December the 30th's call, if we get any more information about the vaccine, I will send that out via email, and we will definitely follow that up with phone calls if we don't hear back from you guys in regards to the clinic. We are hoping to get that scheduled up pretty soon so we can return to some semblance of normalcy in 2021 and have all of you guys out here to help us celebrate the passing of the coronavirus because I don't think any of us will be sad to see it go. So with that, I just want to say Merry Christmas, everybody. And if there's anything we can do, you guys know how to get in touch with us. Give us a call, shoot us an email. We're here to help. And we hope that you all stay safe out there and have lovely holidays. Thank you guys for joining us, and we'll see you in a couple weeks.
Merry Christmas.
Merry Christmas.